Hello, everyone, and welcome to On the Safe Side, a monthly podcast hosted by the editors of Safety and Health magazine, the official magazine of the National Safety Council. This is Kevin Drewley, Associate Editor at Safety and Health. With me, as always, are my fellow Associate Editors, Alan Ferguson and Barry Bottino. We're just a few weeks removed from the 2024 NSC Safety Congress Expo in Orlando, where we enjoyed not only covering news from the show, but reconnecting with readers and listeners like you. Hello there, guys.
Happy pumpkin spice season.
Hello, Kevin.
Thank you all so much for joining us for the October 2024 episode of this podcast, number 56 in our history. This episode is sponsored by The Hub, a new suite of free resources from the Board of Certified Safety Professionals. In this month's episode, we'll take you through the pages of our October issue, including separate features covering generational differences and common worksite hazards as part of our In This Issue segment. We'll also be joined by NIOSH Public Health Analyst Jamie Osborne for our 5 Questions With interview. October is National Substance Abuse Awareness Month, and Jamie will be on hand to discuss more about recovery-friendly workplaces. Is everybody ready? Let's go.
The October issue of Safety and Health offers a variety of feature stories, starting with Barry's look at safety within the multi-generational workforce. Barry's feature details the importance of embracing generational differences and the importance of considering those differences when it comes to communication and training methods. Kevin revisits a popular feature from our past, 7 common workplace safety hazards. The feature, coming 8 years after the previous one, looks at subjects such as working at height, forklifts, housekeeping, and transportation incidents, among others, with help from NSC consultants and instructors. One of those sources, Joanne Dankert, was part of the 2016 feature story, as well as this month's feature. There's also a short quiz on OSHA's confined spaces regulations, which is embedded in the story on our website, safetyandhealthmagazine.com. The highlights of a recent podcast interview with NSC Principal Consultant and former OSHA Deputy Assistant Secretary Richard Fairfax is also available in this month's issue, and provides an overview of OSHA's recently revised hazard communication standard. Finally, our Senior Managing Editor, Jan Yario, talked to a number of personal protective equipment manufacturers to get their insights on challenges, trends, and innovations. The feature covers subjects such as head protection, eye and face protection, and respiratory protection, among others. And as always, you can also check out other insights from safety professionals and the latest news from around the workplace safety world in this month's issue. Find our coverage in your mailbox or online at safetyandhealthmagazine.com.
Looking for expert insights and a wealth of environmental health and safety-related resources? Meet The Hub, your go-to source for everything safety, built by the Board of Certified Safety Professionals. Whether you're new to the industry or a seasoned professional, The Hub has you covered with in-depth guides, toolbox talks, ebooks, and more, keeping you up to date in the ever-evolving world of safety. Accessible, educational, and free to access, The Hub's resources can help you take your safety practice to the next level. Stay safe, stay informed, and visit The Hub today at bcsphub.com to learn more.
As was mentioned at the start of the episode, October is National Substance Abuse Awareness Month, and as often as covered in Safety and Health and on the Safe Side, the issue of substance misuse carries a wide-ranging impact on workers and employers. Having an employer who supports recovery is a significant way that organizations can help. Here to discuss more about the topic of recovery-friendly workplaces is Jamie Osborne, a public health analyst with NIOSH, who has helped lead agency efforts to establish and grow awareness for workplace-supported recovery. Jamie, we welcome you to On the Safe Side, and thank you for being our guest.
Thanks for having me, Kevin.
You're very welcome. How would you define what a recovery-friendly workplace is?
Firstly, before we jump into things, I think it's important to start with a quick note about terminologies. Today, we're discussing recovery-friendly workplaces, but you might also hear about recovery-ready workplaces or recovery-supportive workplaces. So recovery-friendly is definitely the longest-standing term and probably the most common, while workplace-supported recovery or recovery-supportive workplaces are more NIOSH-branded terminology. And then more recently, recovery-ready workplace policies and practices are being driven at the federal level by the National Drug Control Strategy. So it's important to note that there are these different names, but they are all essentially describing the same workplace efforts to protect and enhance workers' safety, health, and well-being through different policies and practices that reduce the risk of substance misuse and substance use disorder, that encourage and facilitate treatment, and that actively support ongoing recovery maintenance. So you'll probably hear me use all of these terms during our conversation, but whether we call them recovery friendly, recovery ready, or recovery supportive, all of these workplaces operate with the same kind of core functions or activities. So they're going to use evidence-based interventions and policies to reduce the risk of substance use challenges, including through education and steps to prevent injury in the workplace, proactively implementing those prevention measures. They're going to encourage help seeking and facilitate access to and promote awareness of treatment and recovery resources that are available to employees, including medication-assisted treatment and peer support. They're going to foster a supportive culture that actively works to reduce stigma and build accurate understanding of substance use disorder and recovery through those consistent, open, educational conversations that include all levels of the organization. They're going to expand employment opportunities for people who are in or seeking recovery by developing and implementing innovative approaches for recruiting and onboarding, such as second chance employment or supported employment models. And maybe most importantly, they're going to recognize that substance use disorder is a health condition. It is not a moral failing. It is not a mark of poor character. And it's not a form of deliberate misbehavior, right? They recognize that recovery from substance use disorder is a strength in their workers. It is not a disadvantage or a weakness.
Well, Jamie, we appreciate you sharing the knowledge about those terms, and I know our listeners do as well. I wanted to ask, why are recovery-friendly workplaces important, regardless of the industry that workers and our listeners may be in?
That's a great question. National U.S. data shows that the vast majority of adults with an alcohol or an illicit drug use disorder are employed. So this is happening in our workplaces. Workplace unintentional overdose deaths from non-medical use of drugs or alcohol increased by more than 600% between 2011 and 2022. In fact, overdose deaths at work represented nearly 1 in every 10 occupational injury deaths in 2022. So it's clear that the workplace is really a critical setting to address substance use challenges. And it really makes sense given how much of our time we spend at work, right? Now, the risk for substance use related challenges, including overdose, does differ across industries. We often see higher rates of substance use disorder and overdose deaths in industries and occupations with safety-sensitive positions, such as construction and extraction. In fact, the rate of overdose deaths among workers in construction and extraction occupations is 4 times that of the total paid civilian workforce. And to be very clear, this is not an indictment of the workers in these jobs. This really is an urgent call to examine the aspects of work and the workplace that may be contributing to these devastating outcomes, and how those work features may be modified to prevent illness, injury, and death, and to boost employee safety, health, and well-being. So that's where these recovery-friendly workplace programs come into play. The National Safety Council has reported that people in recovery often have a high degree of self-awareness, resilience, compassion, dedication, and understanding. And research indicates that they also have lower rates of turnover and absenteeism, more so than the average employee. The adoption of recovery-friendly, recovery-ready, recovery-supportive policies can really result in major gains, like increased productivity, decreased healthcare costs, reduced turnover and related costs, and reduced exposure to substance-related incidents. So by facilitating treatment for struggling employees and by employing people who are in recovery, employers can really tap into a dedicated and reliable pool of prospective employees. So in addition to just making good business sense and supporting the workforce, recovery-friendly workplaces can really be a force for positive change. They can be a model of community leadership and of good corporate citizenship.
Are these programs a fairly new concept, or are there employers in various stages of implementation?
Yeah, that's a great question. Some of the language around these efforts may be newer, but what we often find in conversations with our partners and our stakeholders is that this work has really been going on for a very long time. And many employers and workplaces have been implementing recovery-friendly supportive policies and practices for decades. Now they have the language to describe those policies and those practices, which can be really helpful in recruitment efforts and sharing those effective strategies and promising practices. Now, becoming a recovery-friendly workplace may seem daunting, but it really doesn't have to be. Employers can adopt recovery-ready workplace policies one or two at a time and just evaluate their impact. Gradual implementation can really be undertaken in kind of an ad hoc manner or through a more strategic, staged process that begins with a workplace assessment. An organizational assessment might look at things like the impact of substance use on an organization's workforce, the legal, regulatory, and other requirements that govern their operations or their industry or their sector. It could also look at identifying key internal champions within the organization, along with dedicated external partners who can help facilitate that transition and growth into a recovery-friendly workplace. If an organization is interested in a more strategic implementation plan, the Recovery Ready Workplace Resource Hub, which is hosted on the Department of Labor's Employment and Training Administration web home, has some really great information and resources to help with a more coordinated approach.
Just building off that, Jamie, you've mentioned some resources and some building blocks, but before all that begins, how would you advise an employer to begin the process of building a recovery-friendly workplace?
It's important to remember that workplace-supported recovery programs are not all or nothing, one-size-fits-all, cookie-cutter approaches, right? Some recovery supportive policies or practices will be more feasible or more appropriate than others for different employers and workplaces, and that's okay. Small changes can really have big impacts. But I do think there are a few critical first steps that organizations can consider. One undertaking that is really crucial from the beginning and throughout the journey of becoming and remaining recovery-friendly is the cultivation of an organizational culture of compassion, respect, understanding, and support. This absolutely requires leadership buy-in and active engagement, and can involve a formal declaration of commitment to becoming and remaining a recovery-friendly workplace. For those organizations who want to take that a step further, they can consider an official certification as a recovery-friendly or recovery-ready workplace. Workplaces should also understand the importance of prevention and organizational level interventions. What are those upstream factors that workplaces can address to prevent substance use challenges? That might look like identifying occupational injury and illness risk factors and taking corrective actions, addressing ergonomic hazards that might lead to musculoskeletal injuries, which may then be treated with opioids and put those workers at risk for opioid misuse and opioid use disorder. And of course, providing training and information on opioid misuse, especially timely, targeted information for our injured employees. And finally, I think a really critical and concrete step that employers can take towards becoming recovery-friendly is implementing a workplace naloxone availability and use program. Naloxone is a life-saving medication that can reverse an overdose from opioids, including heroin, fentanyl, and prescription opioid medications. It's easy to use, small to carry, it's safe, effective, and can help save a life. Research has shown that in nearly 40% of overdose deaths, someone else was present. So having naloxone available at a work site can prevent the death of a worker or a member of the public that overdoses on site. NIOSH and the NSC Respond Ready Workplace Initiative both have great information and resources to help workplaces get started.
What are some major challenges or barriers, and could you share a success story or two?
I would say one of the biggest, if not the biggest barrier, continues to be the stigma surrounding substance use challenges. There was a really recent NSC survey that found that 70% of employers and 60% of employees agreed that substance use was a justifiable reason to fire an employee. More than half of employers and employees agreed that substance use was a threat to their company's reputation. That same survey found that half of employers and nearly half of the surveyed employees believed that substance use was a signal that an employee can't be trusted. And again, half of employers and more than 40% of employees said that substance use was a personal, moral, or ethical failure. So we definitely still have work to do. For these reasons, employers may express hesitation toward hiring people who are in recovery, but as I mentioned earlier, there really is evidence to combat these misunderstandings, as well as a business case to be made for workplace-supported recovery policies and programs. Costs are always at the forefront of workplace considerations, so it really is worth examining the costs of workers with substance use disorders. Again, included in those costs are healthcare, absenteeism, turnover, replacement. But what workplaces may not realize is that there really are considerable savings and gains involved in employing workers who are in treatment or in recovery. Another NSC analysis showed that each employee who recovers from an SUD or substance use disorder saves a company over $8,500 on average. Moreover, treatment that is prompted or mandated by an employer is often more successful than treatment that's initiated or encouraged by friends or family members. And again, as I mentioned earlier, workers in recovery tend to be strong employees. They miss fewer days each year than even the average employee without a substance use disorder. They tend to stay in jobs longer, they're less likely to be hospitalized, and they have fewer primary care visits. Also of note for those who are in stable recovery, which is generally defined as 5 years or more in recovery, the risk of a future recurrence of substance use disorder in any year drops below 15%, which is about the same annual risk for a substance use disorder that we observe in the general population. Now, in terms of promising practices and success stories, I really urge listeners to check out a resource from the National Institute of Environmental Health Sciences, their worker training program. They have a publication called Initiatives to Prevent Opioid Misuse and Promote Recovery-Friendly Workplace Programs. So it provides summaries of different initiatives, training programs, toolkits, and resources that have been developed and successfully implemented by different employers, labor unions, community-based organizations, and even government agencies. It includes links to different supplemental videos, personal testimonies, podcasts, and more. So I'd like to share just a couple of highlights from that publication. The first is the unique peer-based recovery and treatment facility that's operated by the International Association of Firefighters. That's for its members who are struggling with mental health or substance use issues. So that facility provides a safe space for members to receive treatment, begin their recovery process, and prepare them to return to work. Another incredible success has been the International Union of Operating Engineers Member Assistance Program. So that's an internal, peer-based program made up of people in recovery and labor leaders that provides confidential health and referral services to its members. The union has actually hired certified mental health and substance use counselors. It has vetted treatment programs, and it holds weekly recovery meetings at the union hall that are also open to family members and non-union construction workers. The program has actually reported an 80% success rate of participants staying in recovery and maintaining their employment. That's really just extraordinary.
Well, we'll be sharing some NSC resources in our show notes online. I know you've mentioned some in the discussion today. Just wondering, as we wrap up, Jamie, any additional resources that you'd recommend for listeners who want to learn more?
Absolutely. Firstly, I'd just like to thank you again for the opportunity to join this podcast. I have so much gratitude and admiration for the NSC's work in this space and the partnership between NSC and NIOSH. NIOSH regularly amplifies the National Safety Council's research and resources, and we appreciate that the NSC does the same. So just a big thank you again. As far as resources, I've already mentioned several, but a great starting point is our NIOSH Workplace Supported Recovery webpage. That page is really rich in links to other resources, including more information on workplace naloxone availability and use programs, medication-assisted treatments, the holistic total worker health approach to substance use prevention and recovery in the workplace, some stigma reduction resources, and more. That page also contains the link to the DOL's Recovery Ready Workplace Resource Hub that I mentioned earlier, which is really just such a comprehensive collection of all things recovery in the workplace. The hub provides information, guidance, tools, best practices, sample policies and protocols. There's a great new toolkit, and really just a range of other resources to help both public and private sector employers to effectively prevent and address substance use disorder in the workforce, to hire people who are in recovery, and support ongoing recovery maintenance efforts in the workplace.
Thank you so much, Jamie, for sharing your insights and expertise with the audience, and also for your kind words about NSC. I know the Council certainly appreciates its partnership with NIOSH as well. And again, we appreciate you joining us today on the Safe Side.
Thank you, Kevin.
With all the football and autumn activities such as apple picking or navigating corn mazes, it's pretty easy to get lost in a haze of falling leaves. That's why we're here with In Case You Missed It. To get things started, as of this taping, we just returned from the 2024 NSC Safety Congress Expo in Orlando, Florida, along with some fantastic keynotes. One of the presentations I attended was OSHA's current activities, and one bit of news from Andrew Levinson, director of OSHA's Directorate of Standards and Guidance, is that the agency will likely extend the comment period for its proposed rule on heat, illness, and injury prevention, and that comment period as of this taping is set to end December 30th. Levinson also talked about OSHA's advocacy for organizational safety culture and OSHA's advocacy for safety and health as a core value. And OSHA has already published its Come Home Safe video series looking at specific workplace fatalities and their aftermaths. Levinson said, when we talk about safety, it's not usually what's going on in the workplace that motivates people. It's I want to get home to my wife, to my kids, to my husband, to my parents, or to my loved ones. And he also let us know that OSHA will offer a leadership toolkit on safety culture and something called Safety in 5, which are essentially toolbox talks. He said OSHA is hoping to build out a library of hundreds of these. He also said the agency is agnostic on which version of a safety and health program employers follow, whether it's OSHA's recommended practices or ANSI or ISO. Just do something in your workplace on safety and health, he said. Barry, what about you?
Well, Alan, I'm going to take us back to Orlando, Florida as well. And the day one keynote, which I covered, was Eric Weinmayer, who is a blind adventurer. He went blind at age 14. And I thought Eric had some interesting connections to safety and health professionals. And one thing he talked about was struggle and learning through adversity. And all of us are going to go through different paths at work. And he made an interesting comment that I wish growth was this nice arc upward. Growth is tumultuous. What if adversity was a pathway to the summit? And for someone like Eric who has climbed mountains, I'm sure he's gone through a lot of adversity. And I thought that was an interesting message to safety professionals to kind of embrace that struggle, to see what's on the other side and find that success on the other side. And he also had an interesting note when he was trying to kayak all 277 miles of the Colorado River through the Grand Canyon. He mentioned that it was the team around him that really brought him to further success. And he said, linking ourselves with great people is the best chance that we have. And I thought that was also a really powerful statement for folks who are working in safety every day and trying to help keep people safe. Kevin, how about you?
I'll also keep it in Orlando and keep it on a keynote topic. And I know just anecdotally, not only talking amongst ourselves, but seeing people on the show floor, it really seemed like this Congress that all the keynotes resonated with everyone. In case you missed it, the closing keynote truly was powerful and very applicable to safety professionals. A few months ago, when we did our Congress preview episode, I didn't expect to be mentioning Mr. Spaghetti for a second time, but here I am. I'm going to do that. It was a keynote given by Kate Darling, who is a research scientist at the Massachusetts Institute of Technology. And her speech really was about robotics at large, but certainly had an overarching message for the safety community. And that is that Kate, while discussing how these new technologies have been out here, and with that, the notion of these robots or this AI are going to take jobs or do this or kind of render humans obsolete, she had the point of view that that really isn't the case. And she had a quote that truly was powerful, and just saying, quote, using a different analogy than this human comparison really helps us open our minds to other ways and other opportunities to use this technology, and helps challenge this constant assumption that it can, will, or should replace people, unquote. So she brought out her lifelike pet robot to illustrate that while it's very common for people to assign these human emotions and things to robots and to AI, that it really is a collaborative venture. Again, with her quote, these robotic technologies and AI aren't replacing what humans can do, they're augmenting that. She also assured safety professionals that they're on that right track. She really backed up that point not long after concluding her keynote, as she was a panelist on the Innovation Challenge, which is an annual venture of NSC, just to showcase what technologies are being used in safety to augment the work that people do.
Now it's our listeners' turn. Is there something important you've learned recently and want others in the safety world to know? Please email your thoughts and feedback to us at safehealth@nsc.org. We're eager to hear from you.
Thank you so much for joining us for this month's episode. We know your time is very valuable, and we appreciate you spending some of it with us, whether you're listening at work, at home, in the car, or at the gym. Big thank you to our sponsor this month, The Hub, built by the Board of Certified Safety Professionals. We encourage you to visit our website, safetyandhealthmagazine.com/podcasts, to check out any of our past episodes. That includes episode number 33, which focuses on OSHA's multi-employer citation policy and features an interview with Jack Liu, co-manager of NIOSH's musculoskeletal health program. The original music for this podcast was composed by Steve Maslin. Thank you so much, Steve. And a big thank you to all of our NSC colleagues behind the scenes who make this podcast go. We'll be back next month to have more safety-related discussions, talk to trusted voices from around the profession, and hopefully make you smile a little. In the meantime, please stay on the safe side.